Hello, dear friend. This is a very interesting case. She is a Paris lady, previous one cesarean, plus she had a 8 weeks pregnancy at the lower part of the uterine cavity, and it was said to be a cesarean scar pregnancy on ultrasound. Plus, she had a fibroid 7 into 6 centimeter, which was projecting inside, touching the endometrium posteriorly. So the anatomy of the uterus is supposed to be distorted. The cervix was very high, and we entered the cervical canal, and here we have seen this sac, gestational sac at the lower uterine part, and the upper part of the cavity, as we can see, is empty, and the ostia we can see on both the side. So though this patient, her hemoglobin was all right, but we decided to instill the vasopressin in the myometrium just as an added precaution. So the ovum pickup needle is used and introduced through the 5 French channel of a hysteroscope. Here we are using 2.9 mm telescope with 4 mm Bitochi sheath, and this ovum pickup needle is inserted into the myometrium, and the vasopressin, which is diluted in the same concentration as we use in a laparoscopy, 1 ampule in 150 ml is instilled. 10 to 20 ml was instilled around, and then the scissor was used to cut the attachments. After we have cut all the attachments, though there was some bleeding but not very significant, and then this mass was freed, and once we freed this mass, then the suction evacuation was done, and after suction and evacuation we again introduced the hysteroscope to see if there are any remnants or RPOCs left, and the cavity was empty and both the ostia were seen, and this reddish thing is the attachment of the cesarean scar pregnancy.